Hello students, according to the anesthetic agent, now we have to learn about pre-anesthetic medication. So, what is a pre-anesthetic agent or pre-anesthetic medication? It is a drug that is given before the administration of an anesthetic to produce preliminary or light anesthesia, given prior to an anesthetic that induces total insensibility. Pre-anesthetic medication serve to calm the patient, relieve pain, protect against undesirable effects of the subsequently administered anesthetics or the surgical procedure, facilitate smooth induction of anesthesia, and lower the required dose of anesthetic. Now we have to learn what are those medicines used as pre-anesthetic agent. Benzodiazepine, midazolam or diazolam. These all categories are drug used as analgesics and amnesia. Next is diphenhydramine, which used to prevention of allergic reaction in case of antihistamines. Next is H2 receptor blocker. In this category, famotidine, ranitidine used in case of gastric acidity reduction. Next, antiemetics. We can use ondansetron as antiemetics to prevent aspiration of stomach, content and post-surgical vomiting. Next is acetaminophen or opioids to reduce analgesia. Now, we can also use anticholinergic drugs like glycopyrrolate, scopolamine to reduce bronchial and salivary secretion, which is irritant inhaled anesthetic, cause excessive salivation and secretion. So, what are those factors is essential in patients to select the anesthesia. Drugs are chosen to provide safe and efficient anesthesia based on the types of the surgical or diagnostic procedure. Next is patient characteristics such as organ function, organ stage, medical condition, and concurrent medication in case of hypertension or bronchial asthma. Concurrent medication means which medications are used to treat the already having disease in the patients. The next stage is the stages of general anesthetics. These all stages are a normal stage, which are induction, maintenance, and recovery. At first, patients are treated with pre-anesthetic medication. After that, induced by intravenous, thiopental, or suitable alternative. Next, we can use muscle relaxant. After that, a mixture of nitrous oxide and halogenated hydrocarbon are used to maintain and monitor. Last but not the least, withdrawal of the drugs, which becomes to help patient recovery. Now we can see here is some traditional description of analgesia and their signs and stages. So, what are these stages? Number one stage is analgesia. This is the period from the beginning of anesthetic administration to the loss of consciousness. The patient progressively loses pain sensation, but motor activity and reflexes are remain normal in this stage. The pupil size is also normal. Reflexes like eyelid, corneal sight, pharyngeal sight, light, these all stages of reflexes are normal. After that, stage 2, or we can say excitement or delirium stage. This period extends from the loss of consciousness through a stage of irregular and spastic breathing to the re-establishment of regular breathing. The eyeballs move in a roving motion and the pupil are dilated. You can see pupil are dilated. The patient appears excited and may struggle. Efforts are made to reduce the duration of this stage and reduce the severity of this stage. Like pre-anesthetic medication we can use. After that, the stage 3 or surgical anesthesia. This is the stage of surgical anesthesia as most surgical operations are performed in this stage. It is furtherly subdivided into 4 planes of increasing anesthetic depth. The movement of eyeballs gradually stop. You can see at the first plane, the movement of eyeball gradually stop. The pupil constricted and then dilated progressively. Progressively, pupil are dilated. Okay. The eyelid and then the corneal and pupillary reflexes are disappear. You can see. Respiration, which at first is deep and regular, becomes more shallow and diaphragmatic. Okay. Now the stage 4 or medullary paralysis. In this stage, medullary paralysis indicating imminent death. The pupil are completely dilated. You can see. And finally, respiratory arrest allowed by circulatory failures occur.